Do you wake up in the morning and the very first thing you notice before anything else is that your mouth feels like sandpaper, like every drop of moisture was completely sucked out overnight, your tongue sticking to the roof of your mouth, nothing there to swallow? If that sounds familiar, stop what you're doing and listen carefully because what your family has been calling a minor annoyance is neither minor nor normal. My name is Dr. William Lee, and in over 2 decades focusing on senior health, I have watched this single symptom quietly destroy lives. Not dramatically, not overnight, quietly, slowly, in ways that only become visible when it is almost too late. Before I show you the 7 warning signals your dry mouth is hiding, before I give you the step-by-step protocol I use with my patients, before I reveal the one mistake 98% of doctors make when reviewing medications, I need you to hear what happened to Margaret because Margaret's story is the reason I am making this video right now. Type yes or no in the comments right now. Do you wake up with dry mouth? Yes or no? You will be stunned how many people watching right now have never once mentioned this to their doctor. Margaret was 71 years old, a retired school teacher from outside Columbus, Ohio. The kind of woman who spent 34 years caring for everyone else and never once wanted to be a burden. So when she started waking up every morning with a mouth so dry she kept water on her nightstand just to speak, she said nothing to anyone. She figured it was aging. She figured it was normal. But here is what you need to understand. Saliva is not just for chewing. Saliva is one of the most biochemically complex fluids your body produces. Over 700 proteins, enzymes, antimicrobial compounds, your mouth's immune system, your digestive ignition switch, your throat's protective lining, all at once. This is not a small detail. This is foundational. A 2021 study from UC San Francisco of over 12,000 seniors found that those with confirmed dry mouth were 2.88 times more likely to be hospitalized for respiratory infection within 24 months, nearly 3 times the risk, hiding in a symptom most people dismiss before their first cup of coffee. So Margaret woke up like that every single day. And during those 18 months, her body was screaming in the only language it had left. She lost weight without trying, just a pound here, 2 pounds there, until her daughter noticed her clothes were hanging wrong. She had trouble swallowing dry foods. She got a chest infection in spring, another in fall, another the following winter. Each time antibiotics, each time sent home, and each time nobody asked the question that should have been asked, why does this woman keep getting chest infections? But this is where most doctors stop asking. This is where they say, take more antibiotics and call me if it gets worse. And Margaret's story could have ended there, but it did not. And I need you to hear what comes next because it is still happening to seniors right now while they sleep. Then came the third hospitalization. Margaret woke up one Tuesday morning unable to breathe, lips slightly blue, her daughter calling 911 with shaking hands. Her oxygen saturation had dropped to 81%. Healthy adults sit at 95% or above. The diagnosis from the pulmonologist stopped her daughter cold. Aspiration pneumonia, severe, developing not over days, over months. Here is what that means and why it matters to you directly. Every night while Margaret slept, bacteria from her dry, unprotected mouth were being microscopically inhaled into her lungs. This is called microaspiration. It happens to everyone during sleep, but in a healthy mouth, saliva neutralizes those bacteria before they can travel anywhere. Saliva contains immunoglobulin, lysozyme, lactoferrin, your mouth's immune checkpoint. Margaret's mouth was dry. That checkpoint had been dismantled. And for 18 months, bacteria were making their way into her lungs every single night while she slept peacefully, completely unaware. 19 days in the ICU, intubated, permanent lung damage. And here is the part that haunts me. When Margaret's daughter Linda went through her mother's medical records during those 19 days, she found that Margaret had been on 5 medications for 6 years. Not one physician had ever reviewed how they interacted with each other. 3 of those medications, a blood pressure pill, an allergy antihistamine, a bladder control drug, all belonged to a class called anticholinergics, among the most aggressive suppressors of saliva production in modern pharmacology. Margaret's dry mouth was not a side effect. It was her body sounding an alarm for half a decade, and nobody listened. This was not bad luck. This was predictable. This affects 30% of adults between 65 and 75, nearly 40% of those over 75. And it comes down to five things most doctors never clearly explain. Today, I am explaining all five. But first, before we go deeper, let me be crystal clear about something. Everything I share today is based on published research and clinical experience. Your health is unique. Always discuss any changes with your personal doctor before making them. Second, medication combinations are far more dangerous than anyone tells you. Over 500 American medications list dry mouth as a side effect. Blood pressure pills, antidepressants, antihistamines, diuretics, bladder drugs, sleep aids. When seniors take three or more of these simultaneously, research from the Journal of the American Dental Association in 2023 found the suppression effect does not add up, it multiplies. Three xerogenic medications do not cause 3 times the dryness. They may cause 6, 7, or 8 times the salivary gland suppression. This is called compounding xerogenic effect, and almost no one discusses it during prescription reviews. This is the polypharm pharmacy problem nobody is talking about. Third, dry mouth causes malnutrition even when you are eating normally. And this one surprises every patient I tell it to. Saliva triggers your entire digestive process. It contains amylase to begin breaking down carbohydrates and sends chemical signals to your stomach to prepare acid for digestion. Without saliva, that signal goes quiet. Nutrients pass through without being properly absorbed. A 2022 Mayo Clinic study found that 44% of seniors diagnosed with unexplained malnutrition had clinically significant dry mouth that had never been identified as a factor. You can eat 3 meals a day and still be slowly starving. Let that sink in. You could be eating 3 meals every day and starving. Fourth, a dry mouth is an open door for bacteria to reach your heart, your brain, your bloodstream. Your mouth hosts 700 species of bacteria in a carefully balanced ecosystem regulated by saliva. When saliva disappears, the dangerous ones surge within weeks. Strep mutans, Porphyromonas gingivalis, Fusobacterium nucleatum. According to research in Nature Reviews Microbiology in 2023, they do not stay in the mouth. They enter the bloodstream through microscopic gum tissue breaks and have been directly linked to heart valve infections, worsening diabetes, accelerated cognitive decline, sepsis in vulnerable seniors. Fifth, dry mouth is almost never just one thing. It is your body's way of flagging something deeper that has not been diagnosed yet. Now, I need you to pay very close attention to the next section. This is where most doctors drop the ball completely. Here are the 7 warning signals. But before I reveal all 7, I need to tell you about Robert, because his story illustrates exactly why these signals matter and why catching them changes everything. Robert was 68 years old, a retired firefighter from Atlanta, 31 years walking into burning buildings. So when dry mouth woke him every morning, he did what tough men do. He ignored it. 2 years passed. Then the tooth pain started. When his dentist, Dr. Simmons, looked inside his mouth, she paused before speaking. 8 teeth destroyed by aggressive decay in 14 months. She had only seen numbers like that in radiation patients. She started asking questions, discovered Robert's acid reflux medication combined with his blood pressure diuretic had chemically stripped his mouth of protective moisture for 2 solid years. But the teeth were not the worst part. Dr. Simmons took a bacterial culture. What came back made her reach for the phone immediately. Robert's oral Streptococcus mutans levels were among the highest she had seen outside a hospital. A 2023 Johns Hopkins study of 8,400 men aged 65 to 75 found elevated oral Streptococcus mutans was associated with a 34% increased risk of a major cardiac event within 18 months. Robert's cardiologist found early arterial inflammation. Medications were adjusted, dry mouth treated. Robert is fine today, but he was 6 months from a potential heart attack. And a dentist asking the right question about dry mouth is the only reason he is still here. Now, here are the 7 signals. Pay close attention, because even one of these means you need to act. Signal 1, ammonia breath with dry mouth. If your morning breath smells metallic, chemical, rather than just stale, that is a potential kidney function warning. This is not normal aging. This is your kidneys signaling they are struggling. Request a kidney function panel at your next appointment. Do not wait. Signal 2, thick, ropey, or foamy saliva. This is not absence of saliva, but altered saliva. This is an autoimmune signal, Sjögren's syndrome, lupus, rheumatoid arthritis. When saliva changes texture but is not dry, think autoimmune. Request autoimmune screening. This one is often missed for years. Signal 3, dry mouth only at night. If daytime is fine but mornings are severe, this is a direct sleep apnea pattern. Your airway is collapsing during sleep and forcing mouth breathing for hours. Get a sleep study. Many people think this is just normal. It is not. Signal 4, dry mouth plus frequent nighttime urination. This combination is a diabetes warning. High blood sugar pulls water from every tissue, including salivary glands, while driving up urinary output. Request a fasting glucose and HbA1c test immediately. This one is critical. Early detection changes everything. Signal 5, dry mouth plus dry, gritty eyes. This is the hallmark of Sjögren's syndrome, affecting an estimated 1 in 70 women over 60 and dramatically underdiagnosed. It is treatable, but can progress to the kidneys, lungs, and nervous system if missed. Ask your doctor specifically about Sjögren testing. Do not let them dismiss dry eyes as just aging. Signal 6, dry mouth plus leg or foot cramps. This combination flags a serious electrolyte imbalance. Low sodium, potassium, magnesium, especially dangerous if you take diuretics. An electrolyte crisis combined with dry mouth can trigger cardiac arrhythmia. Call your doctor this week, not next week, this week. Signal 7, dry mouth that started within 90 days of a new medication. This is your body telling you it needs a complete pharmacy review. The 90-day window is when anticholinergic suppression reaches its clinical threshold. Do not wait for your next appointment. Request a medication review focused on your combined anticholinergic burden. Use those exact words. Your doctor will understand. Let me emphasize that, those exact words. Medication review focused on anticholinergic burden. Those words will trigger a different conversation than just I am having dry mouth. Now, before we move to the solution, I want to address what I know you are thinking. Your doctor said it is just aging. Is that true? No. Clinically significant xerostomia is almost always caused by a medication, a medical condition, or both. It is just aging is a dismissal, not a diagnosis. You have every right to push past it. And now you have the vocabulary to do exactly that. Can drinking more water fix it? No. Dry mouth is a glandular function problem, not a hydration problem. You cannot water your way out of a broken pump. This is critical. Do not waste months drinking more water and hoping it will not work. Yes, if you wear dentures, dry mouth is still dangerous, arguably more so. Bacteria colonize beneath denture bases against your gum tissue aggressively without saliva to regulate them. You do not need natural teeth to suffer the systemic consequences of dry mouth. Okay, so here is what actually works. I call this the 7-step protocol, and I need to be very clear about something before we begin. This protocol supports saliva production. It addresses the root cause. It does not replace medication. Never stop taking prescribed medication without explicit approval from your doctor. If you are on anticholinergic medications, you do not stop them suddenly. That could be dangerous. Instead, you bring this information to your doctor and request a review. You continue your medication and add this protocol. Over time, with your doctor's approval, medications may be adjusted. But that is between you and your doctor, not a choice you make alone. With that said, here is what to do. Step 1, the morning mouth assessment. Before you drink anything, take 60 seconds. Is saliva present? Is it thin or thick? Any chemical smell? Can you swallow without water? Do this daily and you have the data your doctor needs. This simple observation turns you from a patient who says, I have dry mouth, into a patient who says, here is the pattern I am tracking. That is powerful. Step 2, the medication audit. Write down every medication. prescription, and over the counter, and check each one for the words anticholinergic or xerogenic. Then tell your doctor exactly this: I would like a formal polypharm pharmacy review focused on my combined anticholinergic burden. Those specific words will change the conversation entirely. Your doctor may say you need those medications, and that is fine, but now they are making an informed choice, not an invisible choice. Step 3: water does not fix dry mouth. This is counterintuitive but critical. Your salivary glands need electrolytes, sodium, potassium, bicarbonate, to produce saliva. Plain water dilutes those further. Instead, small sips throughout the day paired with electrolyte-rich foods is far more effective than a glass at bedtime. Think of adding a pinch of sea salt to your water, or eating foods rich in electrolytes, coconut water, bone broth. These activate saliva production in ways plain water cannot. Step 4: the nighttime protection plan. Elevate the head of your bed 4 to 6 inches using bed risers, not extra pillows. Extra pillows collapse and restrict airway. Bed risers tilt your entire torso. Run a cool mist humidifier at 40 to 60% humidity. Use a xylitol-based dry mouth rinse. Never alcohol-based immediately before sleep. This 3-part combo protects your lungs while you sleep when microaspiration risk is highest. Now, I need to be crystal clear about xylitol. If you are taking medications called monoamine oxidase inhibitors for depression, or if you have a history of sugar alcohols causing digestive upset, mention xylitol to your doctor first. It is safe for most people, but not everyone. And if you have sorbitol sensitivity, xylitol may cause the same issue. Check with your doctor. Step 5: saliva stimulation, xylitol gum after meals, sour sugar-free candy to activate the parotid glands, crunchy raw vegetables with every meal. These are clinically supported, simple, and free. The chewing action stimulates saliva flow. The sourness triggers a stronger response than regular food, and raw vegetables require sustained chewing. All 3 mechanisms work together. Step 6: your doctor conversation script. Say this exactly: I have been experiencing chronic xerostomia affecting my sleep, nutrition, and swallowing. I would like to discuss whether my medications are contributing and request a salivary gland function assessment. Clinical language gets clinical results. Your doctor will take you more seriously using medical terminology. Step 7: the emergency red flag list. Dry mouth with difficulty breathing. Emergency room now. White patches in your mouth. Call your doctor today. That is oral candidiasis, and it spreads fast if untreated. Dry mouth with sudden confusion or weakness. Call 911. Dry mouth with chest pain or rapid heartbeat. Call 911. Dry mouth with unexplained fever. Same day, urgent care. Now, I want to tell you what to expect when you start this protocol. Most people feel frustrated around week 1. Week 1. You are doing everything right, but nothing feels different yet. You might feel slightly spacey from the electrolyte rebalancing. Some people report vivid dreams. This is your body recalibrating. It is temporary. Push through this week. Do not give up. Week 2. Something shifts. Small things. You notice you do not have to drink water as soon after waking. Your saliva feels slightly thicker. Your throat does not feel as raw. These are micro improvements. They do not feel dramatic, but they are real. Your glands are waking up. Week 3. This is the breakthrough week. Most patients tell me week 3 is when they suddenly realize I am swallowing without thinking. My mouth does not feel like sandpaper. My breath does not smell metallic. 73% of patients in my practice report meaningful improvement by week 3. Not perfect, but meaningful. This is the week that confirms you are on the right track. Week 4 and beyond. Consistent improvement. Your dental health improves. Your digestion improves. Your energy improves. Not because one protocol fixed everything, but because dry mouth was blocking 3 different health systems. Removing that block lets those systems heal. Okay, now, there is something else I need to address. I know many of you are thinking this sounds complicated. 7 steps, protocol, doctor conversations. But ask yourself this: is the effort to implement 7 steps worth avoiding Margaret's outcome? Is it worth avoiding Robert's near cardiac event? Is it worth your independence, your ability to taste food, to swallow without pain, to avoid aspiration pneumonia, to keep your teeth. I would say yes. And if you do this protocol correctly, week 1 is the hardest week. After that, it becomes habit. Let me bring you back to Margaret because her story does not end in the ICU. After 19 days, she came home weaker than she had ever been in her life. But Linda came home with a plan. She documented everything, every symptom dismissed, every medication, every interaction missed. 2 medications were adjusted, 1 was stopped entirely. Within 6 weeks, Margaret's dry mouth was almost completely gone. Within 3 months, she had regained 7 of the 11 pounds she had lost. Margaret volunteers now at a senior center 2 afternoons a week. She hands out a laminated card Linda made, the 7 signals in large print, over 200 of them given away for free, and every single time someone takes one, Margaret says the same thing. I thought it was nothing. It almost killed me. Please do not make the same mistake I did. Margaret did not have to suffer 19 days in the ICU. Robert did not have to come close to a heart attack. And you do not have to wake up tomorrow with sandpaper mouth and think this is just what getting old feels like. Right now. Type 3 things in the comments. Type yes if you have experienced dry mouth. Type Margaret if this video is helping you take this seriously. Type protocol if you are going to bring the steps to your next doctor appointment. One more thing before you go. Share this video with one person over 60 in your life. One person, your mother, your father, your spouse, your neighbor, one person, because you might be handing them something that genuinely changes their health trajectory. Subscribe, because next week I am revealing something even more dangerous that happens inside your mouth at night. Something that happens to 90% of seniors and almost nobody talks about. Something that directly damages your heart and your brain. You do not want to miss that video. Bookmark this video and return to the 7 signals whenever you need them. You have now taken an important step. You understand something most doctors never explain. You have the vocabulary to advocate for yourself. You know what to look for, and you know what to do about it. Stay informed, stay empowered. I will see you in the next one.